The community health assessment is a systematic examination of the health status indicators of a given population. It is used to identify key problems and assets in a community so that strategies can be developed to make improvements where needed. Coming up on Polk Place, we'll talk with representatives from the Florida Department of Health in Polk County to see what it means to our residents. Welcome to Polk Place. I'm your host, Brian Lacey, and joining me in studio from the Florida Department of Health with a fresh new title. See, I have to look down at the paper because she changed jobs. It's Taylor Freeman. How you doing, Taylor?
Hey, Brian. I'm good. How are you?
Doing perfect. So, Public Health Planning Manager.
Yes.
Wow, man.
Yes.
That's
I am
like
now overseeing all of the internal and external plans for the health department, which is awesome. It's really exciting.
And how long you been there?
I've been there for 5 years now.
So between you and my daughter, you guys have more job titles, more job changes.
Oh, yes.
And me, man, I'm coming up on 20 years in this joint, and I'm still on the business card says tallest midget.
Well, you know, you can always come and work for the Department of Health, and we can give you multiple titles if you want.
That's a negative ghostwriter. I'm going to stay right here. I'm cool with that title.
Yes, do what you do. We all do what we're good at.
Yeah. So, you know, during the COVID-19 pandemic, a lot of things you guys are at the forefront, on the front lines to battle this. We were talking about the new norm, and you talked a little bit about, you know, the drive-in, you know, why are you doing 25?
Right, yeah.
Waking up at 7:50 to log in by 8 o'clock.
Yes.
And unfortunately, I got out in the sun this week. I'm looking to put on makeup because my forehead got burned, and I'm like, and you're going, makeup? What makeup?
Right? It must be nice. I mean, you know, first time in makeup in 2 months. So.
You look great.
Thank you. Thank you.
So let's talk a little bit about the community health assessment. Heard a little bit about it in the intro. What exactly is it, and what does it mean to our residents?
So the community health assessment is a process that we undergo every 3 to 5 years, and it basically uses different metrics to assess the health and quality of life of our Polk County residents. So what I like to say is, if you are familiar with, you know, school terminology, it's kind of like a progress report for that time in our lives in Polk County to see what our residents are facing, the struggles that we're dealing with, what we're doing well, what our strengths are, our resources, and how our agencies can better collaborate together to serve our residents.
So let's talk a little bit about our strengths. What did we learn from it?
One of the things that we learned, and we heard this across the board from our community survey, plus we did interviews with agencies that serve the community, and then we also did focus groups with individuals that receive those services. Across the board, we heard that everybody in Polk County, the people that serve Polk County, are extremely passionate about Polk County, about getting those resources into the hands of our residents, about improving the health of our residents, and especially about improving our quality of life and making Polk County a safe and happy place to live, to raise a family, and to age in.
You'd mentioned community partners within the Florida Department of Health. Who are those community partners, and how do they help you achieve this success?
Sure. So we facilitate this process every 3 to 5 years in partnership with Polk Vision. And I know you're familiar with Polk Vision and all the great things that they do. So they're a huge partner, and they help us call our other agencies to the table. For the first time actually in the history of me being with the health department, so at least in the last 5 years, we have actually collaborated with all of the hospitals in Polk County. So we had Advent Health on board, we had Lakeland Regional Health, and then we had Baycare Health Systems, which, as you know, does Winter Haven Hospital and Bartow Regional. So they were all on board, and we were able to collaborate and make sure that every agency was getting the questions answered that they needed for their individual plans. That way our residents don't have to go through one survey every 7 months and just keep redoing it. They'll only have to do this one, and then in 3 years we can do another one. So that was pretty awesome. And then actually through Baycare, we were able to partner with 3 other counties, Pinellas, Pasco, and Hillsborough County. So the community survey that we put out this year actually was the same survey that went out into those 3 counties as well. So we're able to compare our county residents' data to the data of the other counties, which was really cool. And then of course we have our normal partners that are always supportive and always coming to the table, like Department of Children and Families, Central Florida Healthcare, Polk BOCC is a big partner, our indigent care. We have tons of community partners that come to the table, and they sit on our community health assessment work group just to keep us all accountable and help us interpret data.
We heard about the great things that have happened. Let's talk about the areas that need help. What were some of those areas?
So we did a prioritization exercise in July of 2019, and in that exercise we had agency representatives, but we also had community members come to that prioritization exercise, and we presented them with data on 11 different health topics, from oral health to aging health to pediatrics. And they were able to vote based on the scope of the issue and our ability to affect the issue on what the 3 main priorities should be that all agencies need help working on. And our top 3 for Polk County were behavioral health, which is mental health, mental health disorders, and substance abuse, all under one bucket. Access to healthcare, which I'm sure isn't surprising. And then another one that I'm sure isn't surprising, exercise, weight, and nutrition is something that we definitely struggle with.
And surprisingly, for the quality of life things that Polk County has to offer, our Rails to Trails projects. I try and get out on those as much as possible. And the county does, and the city municipalities do great jobs of providing sidewalks. So it's not for lack of having these facilities.
No, I would say that it's not for lack of having them. It might be a little bit of lack of awareness. I was just in a meeting yesterday where we were talking about how we can keep families being aware of using the bike trails and going on family bike rides and doing so safely during our new normal and our current time. But I would say that we do struggle a lot with nutrition. We have some food desert areas in the county that are things that we struggle with. We've got, education on how we need to have more vegetables on our plate as opposed to more carbs on our plate and things like that, because it's resulted in, actually, astoundingly, only 28.4% of our adults in Polk County are actually at a healthy weight. Everybody else is obese or overweight, which, as we know, leads to more health problems along the line.
What are some of the other things that we learned from the assessment?
So we were looking at different things from maternal and infant health to injury prevention. So some of the things that we learned that are my specialty areas are that with our injuries, for the first time, actually, suffocation and unsafe sleep surpassed drowning for the leading cause of injury death in children under 5. Although our drowning rates are still up there. We're still 13th in the county on our drowning rates. So we do need to definitely focus on creating a barrier of safety net around our kids. Another thing that we learned, and I believe you and I actually, Brian, have talked about it a little bit before, is our infant mortality rate is still abysmal. So we have infant mortality is when an infant dies before their first birthday, just for anybody that doesn't know. And if you look at the disparity between the racial groups, our Black population and our white population in Polk County, if you are a Black mother, you are actually 3 times more likely to lose your baby before their first birthday than a white mother. And so we were looking into, how can we better support that population? How can we better provide prenatal care and gaps in services and things like that so that this population can have babies safer? So that was definitely a big thing that we focused on.
One thing I've got to ask about, did they touch on smoking? And if they did, how did we do?
So we did actually look at smoking. It's under the substance abuse section, which kind of threw me for a loop because it's funny because it is a substance and people do abuse tobacco, but a lot of people don't think about that when you talk about substance abuse. They think, hard drugs. So that was interesting. Our smoking rates are not too bad. I say that very hesitantly. If we look at our youth smoking rates, actually, our youth cigarette use has gone down drastically. However, on the flip side, our youth e-cigarette or vape use has risen drastically.
Yeah.
And our youth e-cig use is actually 3 times higher than our adult e-cig use. So that's something we definitely want to keep an eye on, because as we know, your habits as a youth and a teenager, reflect your habits as an adult. So we're definitely going to be keeping an eye on that in the future. With vaping, we actually only have 2 years of data collected since it's relatively new. So that's something we definitely want to keep in our surveys and keep an eye on.
I am living proof that what you do at this age affects you at this age.
Yes, I mean, all of us are, really, I feel like.
I'm out there slinging it around like a Disney e-ticket ride when I was younger, and now every time I move, I'm like, oh.
Right, and now everything hurts. I understand. I have knee injuries from dance, so I get it.
Well, I want to have you finish off with, when we get back to the new norm, per se, how do folks go about finding out about this, and is this information available for dissemination for public groups? How do they go about finding out more and scheduling you guys to talk about it a little bit more?
Yeah, absolutely. So your first question, is this available to public groups? Absolutely. This is as much community owned as it is owned by our community partners. We will be updating the data every year, just so that everybody has a running standing on what our progress is in Polk County. You can find that on the Department of Health's website under polk.floridahealth.gov, and then you just go to the Planning and Statistics tab, and it's right there, 2020 Community Health Assessment. I believe we also might have a link that we're going to be sending to you, so that might be easier for people to navigate. And we also have our community partners are promoting that as well. So any data that is in that is free for the public to use, and they can utilize that at any time. And then as far as us coming and doing presentations, myself and then my counterpart, Jenna Levine, who is the other public health planning manager for the Department of Health, we are available at any time to come and do a presentation. Right now, we still have travel restrictions due to coronavirus, so we're doing Zoom meetings. I actually did a Zoom presentation yesterday, so that went really well. And if anybody is interested, they can just shoot us an email, and we will make sure to fit you in our schedule.
All right, Taylor, thanks for coming in.
Thanks, Brian.
Hey, and congratulations on the new gig.
Thank you.
Yeah.
Thank you. Thank you.
I'm proud of you, kid.
Thank
Keep up
you
the good
so
work,
much.
all right?
Yes.
All right, come back and see me soon.
All right.
All right. Florida Department of Health in Polk County recently completed its community health assessment to reassess the health of our community here in Polk County. This process was a collaborative effort that involved many partners, including Polk Vision, the county's local nonprofit hospitals, as well as other community partners. All entities came together to develop the community survey and collect data. This is the first time the data collection process has been done collaboratively in Polk County. CHA process includes comprehensive data collection and analysis of a wide range of health indicators from various sources to examine the factors that impact the health and quality of life of our residents. Department of Health Polk conducts a CHA every 3 to 5 years to reassess the health of our community and find out what our residents need most. Now, if you need more information on this, you can give them a call, 863-519-7900, or look them up on the web at www.polk.floridahealth.gov.